This morning we are extremely privileged to have Professor Göran Tomson. He is from Karolinska Institute, and he has 1 hour to interact with us, give a presentation, have a discussion on sustainable development goals. Let me also point out that Professor Tomson is a very senior person at Karolinska Institute. He's actually an advisor, no, he's a counselor to the President's office. Karolinska Institute has got a president. Like other institutions in North America, they have presidents. So he's an advisor to the President's office, and that is the Karolinska president, not the president of Sweden. There is no president.
No, it's a prime minister, and I prefer to be the counselor to the KI president, to the prime minister of Sweden.
But he's also a senior advisor to what we call SITE, as the SITE. And he will explain to you what SITE is. He's a founder, one of the founders of SITE. So he's in this country for 3 days. 5 days. 5 days. Yes, including 2 over the weekend. And he will leave Wednesday afternoon. But he's a very, very good friend of Uganda. In fact, he has supervised some PhD fellows who took the joint, what we call a joint PhD between Makerere and Karolinska Institute. And he's extremely pleased with the way those people are performing since they finished their PhD a few years ago. So, without taking too much time, please join me in welcoming here.
I'm a very informal guy, so you interrupt at any stage. I'm not sure I can answer, but I will try. And please call me Göran. It's a true privilege to be here. As Nelson alluded to, and of course Nelson is a global giant in global health, or is a giant in global health. That's not an exaggeration. But it's also so, and let me convey best regards from Stefan Peterson, a really long-standing friend of this place. You know, Stefan Peterson, when he got his job as Chief of Health, UNICEF New York, he clarified that one of the reasons for his career so far was the collaboration with you guys. So you have empowered Stefan Peterson, and you have empowered myself, and I hope that you will keep empowering Karolinska Institute. Let me congratulate you also for the ranking #2 College of Health Sciences in Africa. I also have best regards from the president with whom I work closely since about a year, Ole Petter Ottersen. He is a very, very inspirational person. As we speak, he's sending Professor Sevan Kambo his Lancet Commission on Global Governance for Health. He is, as Nelson, a visionary person. He's been at office about 1.5 years at Karolinska Institute, and we now have a new strategy. Let me, before I get into the presentation, just briefly touch upon a few things. I drafted some years ago, before the president, the Africa strategy for Karolinska Institute. Karolinska Institute needs Makerere, maybe even more than Makerere needs Karolinska Institute. I went through joint publications, and of course, also at Makerere, many publications jointly with Karolinska Institute. Good for you, but also good for us. I believe in a new world where there is much more of reciprocal learning, transparency, and true partnership. This is another message from the President. So we are here, I'm here to do several things. One of them is to have a couple of lectures, and I will soon begin with that. Another one is to pave the way for the next phase. SIDA is withdrawing, as probably everybody knows, from the bilateral project that enables such a successful process with so many actually brilliant PhD students. I've had 40 PhD students in total. You know, with my hair color, you've been experiencing a bit. And I must say that the PhD students from Uganda as a cluster stood out. Not only as very good intellectually, but there is also something about the soul of Uganda human beings that attracts me very much. And never underestimate that. So if you want to read about this successful collaboration, there is a paper, first author is Nelson, with the title Enabling Dynamic Partnerships Through Joint Degrees. And I don't know if you have a list of participants here, and by the way, thank you for coming. If there is a list of participants with emails, if not, maybe someone could take a piece of paper and write his or her name and then send it around, and then maybe Nelson could distribute this paper. Right. We have also together, Nelson, myself and others, worked and developed a paper in British Medical Journal, putting child health in the context of sustainable development goals. My intention is to inspire you to work even more with the UN Agenda 2030 and the Sustainable Development Goals than what you are. And I hope to challenge you to show the complexity of it all. Sight is something that I took an initiative for about 3-4 years ago, working pro bono a year, to strengthen Swedish engagement in global health, Swedish resource base, facilitate knowledge translation. By the way, Nelson is a pioneer also here. And Uganda, several individuals. Also, I think there is a unit at the School of Public Health working with knowledge translation, or it's somewhere else at Makerere. And then we want to ensure that health is considered in all SDGs and implementation of the 2030 agenda. If you want to have a look, maybe I can ask the chair to send this around. All right, let's start. The SDGs has set the agenda to transform the world, ensure health, well-being, economic prosperity and environmental protection, tackling multiple challenges that face mankind. In my way, the SDGs could be said to be a survival kit for humankind. A survival kit for humankind. And my aim with this presentation is to inform you about it, and with a bit of luck, hopefully, inspire you to get engaged. So what is the role of a university? And let's have some interaction, some volunteers. What's the role of a university? Give me one or two, please. And don't be shy. I said I'm a very humble guy. So anybody, what's the soul of Makerere? Yes, thank you.
The role of the university is to train the professionals who can address the needs of society.
Yeah, that's excellent. Train people to address needs of society. Yes, please.
Generate knowledge.
Come again?
Generate new knowledge.
Thank you so much. Now, I think a very important part here is that it's important to reflect on the fact that a university should not only consider what it is good at, but also what it is good for. And you actually, both of you, and thank you for volunteering so quickly, you responded to that. And you also mentioned that historically universities have been drivers of global and local innovation, economic development, improved health and well-being. And research is responsible for much of the background to where we are today. Now I'm going to ask you a difficult question. I will tell you that I was not able to respond to it immediately when the president asked me this question. The year 1859 was a very special year. Anybody who recalls historically what happened in 1859 of major importance for mankind? I'm not, if anybody has, please just share. If not, I'm not gonna have a painful silence. As I said, I didn't know myself. It was Darwin. Darwin, the origins of species. But it was also something else. It was the first successful oil well. So, these two things are responsible for much of what is happening today, and very much related to SDGs. These are landmark events. You know, very much the Darwin's statement is very much a basis of science. And the oil well, that's part of how we have the fossil life. And part of what has empowered societies, but also challenged societies, as we are well aware of now with the climate change and this germ of modern medicine, Darwin's thoughts, and the combination of these two things, again, are very much related to UN Agenda 2030 and the SDGs. Ole Petter Ottersen, who just yesterday evening wrote to the Vice Chancellor, your Vice Chancellor, congratulating him to the ranking. He said that, which you have on this PowerPoint, the closer we get to planetary boundaries, the more pressing it becomes to view health and well-being in the broadest of context. And we see how health is impacted by climate change, migration, etc. We see how socioeconomic factors contribute to health inequities. And we understand how health is inextricably coupled to peace and conflict and our institutions. He, moreover, said, and this is a quotation, so I'll just read it, that SDGs should contribute to a worldview that takes into account that human activities in the past and present now endanger human presence in the future. He's a visionary man. He also understands that you need to collaborate. That's why he is happy that I'm standing in front of you. Now, with all these major challenges, it's heartening to know that a few years ago in New York, 2015, world leaders got together and agreed on the UN Agenda 2030 with the 17 Sustainable Development Goals of 169 targets and 210 indicators. A credo is leave no one behind. Another, this is for everybody. Rich countries, poor countries alike. It's in everybody's interest. Do you think that this would be possible today? This agreement in New York, some almost exactly 4 years ago. Would this be possible in the world of today? To come to this kind of agreement? No. Nelson is shaking his head. I'm also convinced. This would have been completely impossible with the new world. With some of the power games. I'm not going to mention any name, but some of the behavior of some of the most powerful countries, and I think you know what I mean. And he's not alone. So we are happy to have this. But we need to think innovatively. We can't solve problems, say, in the way, using the same kind of thinking we used when we created them. And remember what I mentioned in relation to the soul of a university and what some of the colleagues here said. Who are best suited to innovate, to find solutions than universities? So, here they are. The 17 goals. No poverty, zero hunger, health and well-being, quality education, gender equality, clean water, sanitation, affordable clean energy, decent work, economic growth, sustainable industrialization, reduce inequalities, sustainable cities, sustainable consumption and production, climate change action, life below water, life on land, peace, justice and strong institutions, and partnerships for all goals. This is huge. The challenge is not to give up when you see this, rather to be inspired and to find where you can contribute. Now, to be at this place, then clearly, and also at Karolinska Instituted for that matter, clearly health is at the center of all these goals. And even if health and well-being is explicitly mentioned only in one goal, SDG 3, let's have a look and disentangle, look at the details, look at the targets of SDG 3. And maybe consider what you as individuals are involved in, what Makerere College of Health Sciences is involved in, what Makerere University as a whole is involved in. Just quickly, maternal mortality, children, communicable diseases, non-communicable diseases, that's a project that we've been discussing, sustainable health now yesterday and in the morning. Prevention, substance abuse, injuries, big problem in Uganda, reproductive health, universal health coverage, pollution, tobacco control. I know that Eliseus is working with that area. Research on vaccines and medicines, financing and workforce, and emergency warning systems for risk reduction. This is one goal, the one where health is explicitly stated. I'm now going to be silent for about 40 seconds and ask you kindly to attentively look at this windmill. A windmill that is trying to depict that actually there are health aspects in all other 16 goals. Please have a look. Anybody would like to make any comment? I'm sure that but an issue is here to look at the interactions. And in this paper, where Nelson Sevancampo is a co-author, I think that possibly this should be sent around also as an inspiration to you people who graciously took your time to come here, so that you can find some inspiration. Yes, this is an attempt, it's a study done by Pradhan et al. To look at the interactions of between different goals, okay? And this left column is synergy pairs, and it's based on available statistics from, and quite complicated analysis from different countries. And these are the trade-offs. And synergies, that is when one goal or one target support another. Trade-offs is the reverse. You know, it might be difficult to improve one goal without having negative effects on health and vice versa. And you need to get closer to an understanding of this. And this is of course different also depending on which context you live in. You can see here from the synergy pairs that especially in no poverty, there is a lot of synergies with other goals for no poverty, but also quite a lot with health. In fact, when we looked at child health specifically in this exercise that Nelson Sevancampo participated in, we found that very many of the other goals actually supported child health. When we look at trade-offs, there is one goal that stands out as particularly problematic, and that's responsible consumption and production. I alluded to consumption of fossil fuels, but it's also an issue of food, and I'll get back to that. So we made an attempt to look at children as a center. And then you can organize the goals in different domains, like economy, that is number 8, number 10, number 9, number 12, which is responsible consumption and production. I'm not going to go into all these details. Society, it's obvious that SDG 3 belongs to society, but also education and gender equity. But then biosphere, life on land, life on water below sea level, and climate action. And some improvements, for example, increase in some consumption will have negative effects on health. And some dimensions of economic growth will be problematic for the biosphere. And how should a decision maker, take your country, how should the responsible ministers, even the president, know where to invest in order to have a sustainable development of your beautiful country, Uganda, unless he or she knows some of these things. And it's quite a steep learning curve in the beginning. But I think that universities such as yours, you're well suited to assist here. Now, I was interviewed, for some reason the Bulletin of the World Health Organization contacted me and they said, we want to know a little bit about your trajectory, your career. And I said, why? And they said, well, we want to put that in the context of SDGs. So I made an interview, and I can leave one copy here. And I made it to problematize SDGs and also to clarify how scientists could contribute. If you take the example of diets, and that's obviously related to responsible consumption and production, but not only that. I mean, diets are good for health. That's very clear. I happen to love meat and French fries, chips, and that kind of thing. But it's not good for health, that's given. But more than that, it's not good for society. It's not good for the planet. There are so many synergies and positive effects of switching to health plant diets. Anything also freeing land. There was an amazing map I saw on a major daily newspaper in Sweden. It was South America, if you will. I'm trying to depict South America here, okay? And in the middle was a giant beef steak covering the whole of Brazil. And Brazil in itself is responsible for almost 35–40% of the meat consumption in Europe. And what the forest fires in Brazil, they are not by chance. Huh? So unless Europeans do something about their consumption of meat, we can't put any pressure on countries that produce the meat and to deforestate, etc. Everything is a system that hangs together. I said it before, I repeat it. Universities must lead on sustainable development goals. The International Association of Universities and the Higher Education and Research for Sustainable Development has allocated responsibility for specific SDGs to different universities. And I made the president decide that KI should join this. So we joined IAU half a year ago. It should have been done longer ago, but KI is not always the quickest. To my surprise, happiness, delight, I found that the International Association of Universities had given Barcelona the coordinating responsibility for SDG 3. And Dublin was one university, Sydney was one university, KI was one university, and which was the fourth university. I was so happy to find that. Makerere. So Rhoda, the Dean of School of Public Health, I think is the contact person and the PI for that, and I will meet her Wednesday. Okay, and we are developing at the moment a landscaping roadmap, some kind of scoping review to see what is going on with SDG 3 at different universities internationally. Clearly education is central in relation to SDGs and universities. Yeah, I don't have to say so much about it. I will get back to it in some of the other PowerPoints. What I wanted to get at is we now, since a couple of months, have a strategy. And it's a KI Strategy 2030. It's well aligned with the UN Agenda 2030. And it's meant to enable that KI is inspired by the SDGs and takes responsibilities for the SDGs. One of the dimensions of this is strengthened internationalization and more collaborative work in global health. I said that Ole Petter, our president, is a visionary person, and he sees collaboration with Makerere as a key here. And I will mention this to the Vice Chancellor. I will give the Vice Chancellor a hard copy of this also. In order to walk the talk, we had a meeting in March, co-organized by KI, Gothenburg University, and Chalmers University, which is a technology university, and SITE, the Swedish Institute for Global Health Transformation, and it was hosted at Karolinska Institute. And these were some questions that he posed, the president, in his opening speech. I should also mention that we had excellent keynote speakers. We had Michael Marmot, the Marmot Commission, Social Determinants of Health. We had Helen Clark, the former minister from New Zealand. But his questions were, how should universities contribute to society? What one of you mentioned. That in a situation which even more than before requires insights into complex interdependencies between economy, environment, and health. And how should we reconfigure our educational programs to capture the engagement of our students? And I'd be keen to know and listen to you how Makerere is, at the end of this presentation, is doing here. One of the conclusions from the meeting, which was attended by 600 people, was use the engagement of students. Students are more engaged, more inspired, it seems, than professors. Use student power. Is that what you're doing at Makerere? Now, here are a few things that I think are helpful when you reflect on how your university could be helped by the SDGs, respectively help the SDGs. So the SDGs, as I just mentioned, should increase demand, facilitate the branding of the university, offering a framework of demonstrating impact, societal impact, and not least this, Karolinska Institute is very much driven by researchers, top-notch researchers, laboratory researchers, Nobel laureate, fixation and that kind of thing. But and that will happen in Europe definitely, I don't know about here, but globally also, so that it must involve you. There will be more and more requests that proposals for funding, research funding, would include sustainable development goal elements. So the sooner you get prepared, the greater likelihood that you will get funding. And then, of course, internal, external partners. So how do universities help SDGs? Well, obviously, knowledge and solutions to the SDGs. And training what will become leaders of the future, implementers, SDG implementers. And then one very, very important issue. If you're going to handle and solve the challenges of the goals, SDGs, then you need to facilitate processes for intersectoral work. Let me pause a minute and ask you and see if you can kindly provide me hypothetical answers at least. In Uganda, is intersectoral work for health common? That's a very leading question. or anybody that like to reflect on intersectoral work in Uganda, and then I will, in a transparent way, tell you about Sweden. How is intersectoral? Is that something that is strong on the agenda? Is it well developed? No. Thank you. That was a very clear-cut answer. The situation is the same in Sweden. So we have created an inter-parliamentarian group. It hasn't been done before. So we will meet representatives from, I think, 7 of the parties, a few of us. The president will chair the meeting, I will participate, and another professor, to see whether we can start more of intersectoral collaboration. And it's also part of the vision of SITE. Now, how do you get started? I'm not, implying that Makerere has not started, but I actually find this quite useful. And Australia is one of the more developed countries when it comes to this. Map what you are doing. Is that done? Do you have a map on the SDG engagement? If not, the sooner you start, the better. Build internal capacity. I don't know if it's a network organization or you host it within the School of Public Health. Maybe Rhoda already started this, or any other institution. Identify priorities and gaps, and integrate, embed SDGs within university strategies. I've seen your vision mission statement, but I don't know about your strategy document. And unless the SDGs, UN Agenda 2030, are embedded in the university strategy, it's a lost opportunity. And then monitor and evaluate. And these are suggestions on even more practical on how you could incorporate SDGs. I told Nelson yesterday that the president requested me to do a video, because so many people at KI don't know UN Agenda 2030 and the SDGs. And if you don't know, how can you act? And then some know, but think that this is far too complex and no poverty. I'm doing very focused laboratory research. I'm very successful. Why should I bother? My job is not related to SDGs. I would, in contrary, say that most researchers, in one way or the other, are related to some aspects of the SDGs. So there's a need for teaching and enlightenment. Then embed SDGs into the curriculum. We have started a project, one-year project, where we are revising all our curricula and see that SDGs are properly integrated, embedded. And then use SDGs in discussions, lectures, such as this discussion. And then use, again, students. And let each institution or department work on it. One of the more developed, when it comes to SDGs, universities in Sweden is the Royal School of Technology in Stockholm. They have a vice president that has half time to do all this work, and he also has some million Swedish crowns. Very little of this is at KI. I have worked pro bono, and now I have a few percentages. But I'm trying to get the fragmented picture clear and to engage individuals. And some individuals, and I would assume that is the same in Makerere, have worked on environmental and local sustainability. You know, how do you handle waste? Can you influence what canteens, what restaurants serve, etc., etc. So, and as I said, this is something that everybody will get, I'm sure, by the coordinator of this lecture. A few special elements here. At KI we believe strongly, and not least the president, that one needs to work reducing health inequalities, and that's a cross-cutting theme. And here you can see that several of the SDGs are particularly much related to reducing health inequality. I'm not going to read them to you. And then there's one thing more. Sweden is the country of registers. There is especially one reason why American scientists want to work with Swedish scientists. And it's not necessarily that we are very good, but we have the registers. We have the data. And we have data in a way that US is not close to. And you can do very interesting epidemiological studies with those data. Now, one of the essentials to move this area is to have quality data. And of course, countries are different in terms of how you have quality data. And I'd like to acknowledge, again, Uganda, for having established several demographic surveillance sites. I happen to know that Nelson initiated the Rakai demographic surveillance site. I know that the School of Public Health has initiated the Iganga Mogaye. Is that, how do I pronounce it correct, Eliseus? Mayuge, thank you, you see. Sorry for that. Iganga Mayuge demographic surveillance site, where you get data. And this is so important. And our belief is that partnerships, SDG 17, should include supporting countries which do not have good data, and that inter-university collaboration is absolutely essential for this. Some resources. And one resource is the collaboration between Swedish universities. I believe in visions and in ideas, and the very small site secretariat, there is only one person full-time, and then a few people working part-time like myself, pro bono or not. We have done a lot of things. One of those is to initiate a project where Nelson is a member and with Uganda National Academy of Sciences on climate, health and change. This is only a planning grant so far, but we hope to develop it further. But we have actually a network of Swedish universities. That's one of the deliverables. So we have established, it didn't exist before. So we consider ourselves as a platform. So we meet once every semester discussing issues. SDGs is one of the issues. And that's a very good thing, because we need to be united in order to handle the complexity of the SDGs. Then there are some free online tools for learning. And in particular, these last 5 or 6 SDGs, I would encourage someone to share with those responsible for teaching, education and science here. There are quite a lot of online tools that are free of charge. And if I would select one of them, I would advise you, and I hope that the broadband is good enough, because I know it's much easier in my corner of the world than in your corner of the world, to do the SDG impact assessment tool. Hello, welcome. Where everybody, each and every one of you in the room, can see how your best are linked to an SDG, several SDGs, or targets of SDGs. And if it doesn't function, I would be very happy to get complaints, because this is developed by the Sustainable Development Solution Network. Let me go back a few things to show. I know I had it earlier. Do you remember the Sustainable
Development Solution Network. Anyway, it's wonderful that you come, Charles, because I just left this strategy document which shows how well attuned KI is to the UN Agenda 2030, but also reinforcing why we want to work with you. Never mind, you can look into this, and then and it doesn't take a lot of time. And then you get your own profile for how you are related to work with the implementation of UN Agenda 2030 and the SDGs. And it's also a more interesting, more enjoyable way of learning the SDGs than to listen to me. My intention, as I said in the beginning, was to be an appetizer. So I hope that I have not bored you, but given you some inspiration to take responsibility for the challenge of mankind. And if you should remember one thing, I would like you to remember how I started. What did I call, and this is not UN terminology, what did I call the SDGs? Great to see you. What did I call the SDGs? Anybody that remembers? Can I write here? Yes, please.
Survival kit. Survival kit.
Survival kit for humankind or for mankind. This should be looked upon as a survival kit for humankind. So it's not like, no, I don't want to work with this. I think we are all obliged to work. And if not universities get engaged, who should help decision makers? And who should push governments, etc. So, with that I end. And we have a few minutes before I have to leave for the meet the Vice Chancellor. I guess I have a meeting with him as well. So over to you to decide on how to do this.
Yes, so if there are any questions or comments, please let's hear them. And the principal will make some comments at the end. Questions, comments?
Was it this boring?
No, let me ask two.
Yeah, you have one here, sorry.
One. Oh, sorry.
Yes, so thank you for that good presentation. You had a slide that showed us you were focused on interaction.
On?
Interaction
Yeah.
between
Yeah.
different roles.
Yeah.
And I was wondering, and you kind of emphasized signage. Has there been a situation where there could be some antagonism between?
Yeah, the trade-offs. Yeah. Is there any particular you want to comment? It's this list.
Yes, I mean, maybe I'm just an example of quality education and health.
Yeah.
I think putting them separate creates opportunity for antagonism. They should really be one.
Absolutely. Thank you for bringing this up. I didn't say it, but I guess the conclusion of what you're saying is that the UN Agenda 2030 and the Sustainable Development Goals and targets are not ideal. They are not developed in with a scientific basis. It's a lot of policy, but the word agreed on. There are several examples like the one that you took that you could criticize. But this is what we have. We even have indicators. And I'm of the firm belief that with all limitations that exist, and you mentioned one, this is still the way to go. And everybody, of course, has an opportunity. And again, which institutions are better suited than universities to, in a constructive way, criticize, but also provide aid? Yes?
International Association of Universities
Yes.
allocated some universities to coordinate.
Yeah.
Is there an African university that is coordinating?
Brilliant question. I don't think so. I'm not on top of that. But you know me. I'm a transparent, frank Scandinavian guy. I'm not very much a diplomatic political guy. When I saw how these things were being allocated, I was challenged. I talked to the president of IAU, whom I happened to meet. And it's not only the issue that they were not well allocated across continents. I think there's one African. I will check and I will get back to you. But there were no criteria on the selection of universities. And you may, for example, I don't want to be critical to that university, but if you look at the coordinating university of SDG 3, which is health and well-being, I was surprised to find that it is University of Catalonia, which is in Barcelona, which is not very well known for that. Why wasn't it Makerere College of Health Sciences or Karolinska Institute or I don't know, Peking University or whatever? But this is again what we have. That's how it is. And if I may again continue to be frank and transparent, University of Catalonia really needs Makerere and Karolinska Institute. We've had a few Skype interactions. I will talk to Roland about it. The good thing is that one of the best benchmarking universities on this issue is part of it, and that's Dublin University, which is very good on SDGs. Well developed. Two very good. Yes, please.
Thank you so much, Professor. You talked about the engagement of students.
Absolutely.
How much more can we students be involved and engaged?
That you should ask the leadership of Makerere. I would be crazy and I would be kicked out of not only Makerere and Uganda if I told the leadership of Makerere how to do this. I don't know the mechanisms, but communication is not only the message. Communication is very much about the sender and the receptor. And the receptor, first of all, the receptor has to be enlightened, engaged when it comes to Agenda 2030 and the SDGs in order to welcome and then utilize the students. I don't know how you do here, but now I risk being kicked out, but I'm so old that I can take that risk. Now, at Karolinska Institute, a small group of students got together and decided we will every year have a global health night, a couple of hours every year. And that has been extremely successful. It fills the aula, 1,000 people. So I'm sure you have student representatives and student union, stuff like that here. So I would make sure that those people put SDGs and Agenda 2030 as part of the portfolio which you work with. And then I would respectfully approach the leadership of Makerere and Makerere College Health Sciences and ask how you could work on this. I strongly believe that this curriculum revision, which is an enormous amount of work at Karolinska Institute, is a fantastic opportunity. That was an attempt to answer. Anything else? Yes, please.
Thank you so much for this insightful presentation. I just want to reflect a little on what happened when you look at the MD and the Millennium Development Goals.
Yeah, yeah,
Because overall, at the global level,
yeah,
there were some significant achievements.
yeah,
But when you segregate and look at the regional level,
yeah,
in some regions, particularly Sub-Saharan Africa, Southeast Asia,
yeah.
the improvement was so minimal. And I am afraid that the same will happen for the SDGs, that at the global level, there may be some improvement. But again, in certain regions, nothing significant may happen.
That's a brilliant question.
Yeah, so,
But that's a big difference, huh?
yeah, so my question is,
Yeah.
what would be, I don't know whether you may be the right person to answer this question, but what are your opinion on what do you think can be done to try and bridge this inequity in the
No, it's a must, of course, but there are big differences. SDGs are not MDG 2.0. It's completely different, as my third PowerPoint showed. It's joint, it's high, low, middle income countries. And it's about survival of humankind. It's a survival kit. And of course, it's as always when you have this thing being decided in New York or I think I know where you're getting, or Geneva, etc. I agree with that. And my way of working has always been an attempt to be very sensitive to the context where I'm working. And also to never believe that I don't believe I'm here to help. I never. I'm here to develop knowledge together. I'm here to learn together. And I think that, I think I said that before Charles came, that this extremely successful Karolinska Institute with Intersectoral Collaboration. Amazing. It's, you know, it's good for my career. It's equally good for Karolinska Institute. It's very important. And it's going to be even more important now. So one solution to this, as I see it, is, and that was another of my PowerPoint, is that universities must take the lead. Okay? If universities take the lead on this, then it doesn't matter that much. Well, it does anyway, what the US says, but we can create counter forces, evidence, knowledge for the decision makers in Uganda. And we work also to create this evidence for decision makers in Sweden. And as I was mentioning, we are trying to enlighten the Swedish parliament. I mean, you identify the challenge, but problems are to be handled. And I think I have to end to come in time for the meeting with the Vice Chancellor at another place, but I will quote a famous European author, Beckett, and this is something that I've used: fail, fail again, better. But avoid NATO, no action, talk only. Forget about the military alliance. Everybody thinks about that when it's NATO. I will think very much about NATO, no action, talk only. Or a Danish philosopher, P.T. T. I think Eliseus will remember it. Most of the students that I've been related to have heard. Things take time. And of course, things take time. And you may think that 2030 is very, very long, far away. It's not. But at least there is a strategy developed that we could work with for another 10 years. I hope, for the sake of survival of my grandchildren, that, and I'm serious with this, that you will contribute. Thank you so much.
So, our guest speaker this morning, colleagues who are here and all of us. The College of Health Sciences, good morning. Yeah, I'm sorry I'm coming in late. I was aware about his coming, but I did not. The people coordinating my program had not put into that issue that I had to go for a visa interview. I
perfectly understood.
Very quickly, and had to make sure I come back.
Yeah.
So I would like to welcome you. I know the team has already welcomed you, but also to thank you for not just coming to discuss all the other issues, but sparing some time to meet our colleagues here at the college and discuss something about the SDGs, which you have clearly termed as a survival kit. So I thank you for that. I know time is running very fast, but I want to welcome you on behalf of the college, and also to thank you for always thinking about the college and coming again to make sure that we continue this collaboration.
And there is a suggestion that is on your table, and you also have the KI strategy 2030.
Yes.
So Isaac has this.
Okay. So I'm sure all that we have, our relationship is so strong that everything is possible. So I would like to appreciate Professor Nelson for coordinating this and for ensuring that people come here and hear you speak. That's why the College of Health Sciences is very unique, and that's why we have maintained the global leadership. I saw you make a comment about our good position, our success.
Rank number 2.
It's not us who make it, but it's us and our partners. And Karolinska definitely has been one of the main partners along this road. So I want to appreciate what you are saying about the SDGs. Is very, very important, and the college was part of that contribution because we belong to the M8 Alliance. And the M8 Alliance made a very strong contribution towards the development of the Sustainable Development Goals.
Absolutely.
And we continue to contribute and to discuss and to follow up to see how far we have gone. Whether Uganda will achieve the SDGs, I think it depends on our country and our implementation, and on us. We have to be part of that move to achieve the SDGs, because SDGs are a bit different from the Millennium Development Goals, and especially the health one, I think we have the contribution of all the SDGs. So Tomson, thank you for coming to share with us. I think as you move around, we will get some little time and
my pleasure.
Talk a bit. But I would like to challenge all of us that what he has said is something very important. We need to look at it. I'm glad that all the schools are represented here, and therefore you can continue the discussion when you go back to the other schools. So